Welcome to this tutorial I'm going to be doing with you on the skeletal structures of our femur. And I'll also throw in the patella as a bonus because why not? As always, let's start with our directional terms first so we can orient ourselves in regards to this picture here. Now we have the proximal and distal ends of the bone, as well as the anterior and posterior sides of the bone. And with our patella as well, we're also going to have the anterior view. So we have our anterior patella here and the posterior view of our patella as well. And before we get started looking at our femur, let's just start with our patella. So I'm just going to outline it now, and most of you will have heard of the patella already, and it's the bone we often refer to as our knee bone. So outline the posterior as well, and that's our patella. There are a few structures we'll need to know, and the first one is the apex. So the patella is our knee bone, and it has several features, the first of those being the apex. Now the apex of the patella is actually on the distal side of that bone, or the inferior side of that bone, and I've just highlighted it here. So apex being the tip of the patella, even though it's facing toward the floor. So remember, an apex just means the tip. Doesn't necessarily have to be on the vertical tip. We also have the facet for the lateral condyle of the femur, which is a large depression we can see here on the posterior aspect, which is going to articulate with the lateral condyle of the femur. And we also have a facet for our medial condyle of the femur, which is going to be a little bit smaller than the lateral condyle, but is going to have the same job. It's just going to articulate with the medial condyle of our femur. I'll just outline that one here too. So it's a little bit smaller, but it has the same job, and that's on the posterior surface. We will see our condyles on the femur sketch here in just a moment, and we'll talk about those as well. Now, the last structure unique to the patella that we need to know is the surface for our patella ligament, which, like it says, just so happens to be the surface for our patella ligament. So I've just outlined it here. And I'll also just sketch in this patella ligament that's going to be attaching to that point. Okay, we've conquered our patella and we can move on to the femur. And starting at the top, the first thing we can see is the head. The head of the femur has a unique shape, and yep, you guessed it, like our humerus, it forms part of a ball and socket joint, and it's going to interact with our pelvis. So it's part of a ball and socket joint, and as part of the femoral head, we're also going to have a small depression within it. And this small depression is called the Fovea Capitis, or Capitis, depending on how you want to say it. And I'm just highlighting it here at the top of the head. It's a small depression which is going to act as an attachment point for ligament. So once again, that's our Fovea Capitis. Now just below the head of our femur, we can find the femoral neck, which I've just highlighted in purple here. We don't really need to know much more about the femoral neck, apart from it's the spot that's right below the head. If we move on to the next unique structure that I've highlighted in blue on the proximal posterior side of the bone, we can see the greater trochanter. The greater trochanter acting as a prominence that is an attachment point for our tendon. And we also have a lesser trochanter that I've highlighted in orange that we can see from both the anterior and posterior aspects. That's also going to act as a tendon attachment point. Now, between these two trochanters, we have two structures. The first being in green here, called the Intertrochanteric Crest, the Intertrochanteric Crest also being an attachment point for tendon, and an intertrochanteric line, which we'll see mostly from the anterior view. So I've just highlighted the intertrochanteric line there in red on the anterior aspect of the bone. Once again for tendon attachment and ligament attachment. Moving back over to our posterior aspect, the next feature I'll highlight here in blue now is our gluteal tuberosity. The gluteal tuberosity is sometimes termed to be part of the linea aspera, but for the sake of this video we will separate them functionally. The gluteal tuberosity is a prominence of bone that, like the name suggests, is an attachment point for the gluteus maximus muscle. And just below that, like I just mentioned, we can see the full body of the linea aspera. The linea aspera being a long, roughened surface that is going to act as a tendon attachment point for several different muscles. So it's quite a long and distinguished feature, as we can see on the drawing here. Now what I'm going to do is split this video into two parts, and we'll do the distal half of the femur because I'm running out of room here. So I hope this first half has been helpful, and I'll see you in the second part.